Welcome back, friends. As I suggested that I would be going for a case or an example related to the changing concepts in marketing, products and services, which would largely justify what we tried to build upon in our earlier section. And I would just give you a very quick recap on the elements which I tried to build upon, as far as the whole scenario goes. So this is how we tried to understand how bundled products and services are, customers of customers, backwards and forwards analysis of value chain, NCR kind of examples, industry analysis as the authors say, competition, five forces model and beyond competition and share of pocket as well, and then some examples like Yashaswini and Eureka Forbes and Apple, and then we focused upon 5 elements which authors talked about: industry mapping, understanding the customer, pooling the customer experience to understand the industry, developing value propositions of strategic value, strategic selling, projecting, marketing downstream. And here comes the example. So, diarrheal disease are one of the leading causes of death in developing and underdeveloped countries. The scenario is similar in country like India as well, with diarrheal disease being responsible for 13% of deaths per year in children under 5 years of age, which is very big. And hands are the one of the main vector of diarrheal pathogens, transferring them from surface to surface and person to person. And this is a very important thing, and remember I talked about some habits to be developed amongst customers and involving the customers and so on. Research on preventive behaviors for diarrheal disease shows that washing hands with soap could significantly reduce incidences of infection. And soap is perceived as a beauty product. It had been traditionally, although we have come of age now. So the usage of soap and hygiene has become a very prominent factor as far as India goes, but India is a big country and India like countries are there, so many of them are there. So if you will look at larger number of countries wherein similar kinds of situations are there, wherein rural people are there and people are associated with different kinds of manual work also. So these kind of similar situations are everywhere. So when we talk about soap, so it has different kinds of perspectives associated with that. Then cost is also associated with this kind of a thing, although soap industry has done several kinds of innovations. So Hindustan Lever, through its innovative communication campaigns, has been able to link the use of soap to promise of health as means of creating behavioral change, and has increased sales of its low cost mass market soap. Lifebuoy's increased usage with health, HLL build new habits involving its brand and build loyalty from group of customers new to the category. And the company decided it would have to educate customers about germs and consequences of germs on health to increase soap usage as a means of deterring bacterial infection. They teamed up with the rural India outreach arm of Ogilvy and Mather to design a behavioral change education campaign. This is an advertising company, Ogilvy and Mather, and they focused upon uniting the health attributes of Lifebuoy soap with health messages of germ eradication. Lifebuoy Swasthya Chetna, awareness about health, and or Lifebuoy Glowing Health campaign was brought in, and they triggered washing hands from visual clean is safe clean to a social convention of frequent hand washing. And this is how they created behavioral change: school and village presentation, Lifebuoy Health Day, diarrhea management workshop, launch of Lifebuoy Health Club. Several kinds of elements: health education, health awareness, usage of Lifebuoy, health maintenance, reduction in terms of deaths, helping the government in terms of their efforts in doing that, and bringing in a continuous change, and alongside uplifting the complete soap industry. That is what things are as far as this structure goes. And the reference is fortune at the bottom of the pyramid, a very important contribution by Professor C.K. Prahalad in as far as the whole scenario of marketing and strategy goes. So Lifebuoy Swasthya Chetna Thali was also introduced in Kumbh Melas, an event which sees one of the largest congregation of humans in the world. In fact, Kumbh is usually the largest congregation ever in this world. 2001 and probably one more, 2001 especially I remember, was the largest congregation in 3000 acres plus almost 30 million people, huge at one point of time. So that is how this is taken from a reference of 2019, hand washing, a simple habit for healthy living. And now I would be taking you towards the elements of, as far as services, innovations in services marketing. Very important thing which I want to put up here is that how to look at services. Authors definitely look at with the perspective of intangibility and tangibility, differentiation between products and services, lots of text including all the marketing books, and whichever we are also referring to, and several papers, they look at services vis-a-vis products. So, they say that if it is not a product, then it might be as far as the service goes. So, let us look at and then there are different elements of how to comparatively look at products in terms of services, I was saying, with tangibility and intangibility as far as the situation goes. And then there is a whole lot of text which focuses upon that services cannot be differentiated from the service provider, which is a very important demarcation in terms of as far as how to look at services. But you see, we are talking of innovation in services marketing, and I would be coming to you with different kinds of elements which authors have brought in and several other authors have brought in. There are good services marketing books also available, but we would be focusing upon innovation perspective here. But before we go ahead, just look at a service with reference to this word, commitment. Commitment talks about intensity. Don't you expect that when you go to a dentist or a doctor? You do, whichever price bracket you are there, but you try to expect that as far as the whole thing goes. Then this, and I am trying to build up a case here, then try to look at reflexivity, as if I want you to serve me as if I would have served you, or I want anyone should have served anyone. Reflexivity in terms of reflection and intensity. I want you to understand my plight, I want you to understand my joy, I want you to understand almost everything. If children go to a park basically, and this attendant somehow serves those children with different kinds of games and joy, and children are happy, and they carry those things in their memories. For example, a book reader reads this beautiful story to children, and that story may change the effective way a child might think. Whole lot of structure would evolve in a different kind of a fashion as far as the situation goes. So, you see, that is again a perspective. Then try to look at this word, discipline. If somehow I am expected in terms of being committed, reflexive, I must be disciplined to keep up to the levels of the expectation, and that is what services is all about. And then there are few more things which one must think. Services must resonate a thought, I am there for you. That is how one must look at as far as the services go. I should not be using this particular line, but I feel tempted to use this, main hoon na, I am there for you. So, that is the perspective of as far as this thing goes. And then another element of ownership. Authors have talked about these terms and these words with different kinds of reflections and examples. Ownership, as if I own the thing, I wish to derive that benefit, as if you would have derived that if I would have provided you those services. For example, geriatrics, the medicine or medical care for elders who are unable to express themselves many a times, elders who are slightly shy or they might be depressed in terms of as far as expressing themselves in due course of time. How to serve them, how to be considerate in terms of their requirements go. We have to understand this very intensely, and I have chosen this example because this is going to be huge in terms of future of Indian space goes, market space goes, because ultimately we would be moving towards, large part of our population would be moving towards the elder age, and many of those would be requiring these kind of services because it's a nuclear family structure which has evolved in due course of time. So, they would be taking care of each other, but then to what extent? And that reminds me of a documentary which I have not yet seen. It is about to come. I think this Wednesday it would be released by Netflix. Today when I am recording, it is 28th of August 2023. So 30th of August might be released. That would be on 5 places the author visited in his 20 years journey, where people are living more than 100 years of age, and they are happy. So those that kind of a documentary, I am forgetting the name. I would be mentioning about that someday to you. That's an interesting documentary. Just forgot the name. So now creche, for example, child care. Then COVID-19, we have seen this situation very rampant, basically, especially in terms of elders. I remember one of my friends, he was telling me that his father got infected, and somehow they were not allowed there, and the staff, they were very helpful, they were doing whatever best could be done, but then somehow the person of that age might not have been able to feed himself and so on. So several kinds of things are there, and that was a devastating time. So this cannot be a very right example to talk about, but this is an extreme situation which we can imagine in terms of as far as this situation goes. Is the price related with this? Yes, it is, but do you expect something short of best if the price is low? Might not be. Product, we can definitely think in terms of as far as the whole situation goes, but services might not be. And you see, for example, priests, so they conduct pujas or rituals for us. Do you expect anything short from them? No. Teachers, however the charges or whatever the charges are, for example, a tutor comes to your home to teach children, would you be expecting something less, whatever the charges are? And then doctors, and it's slightly an important example which you should be looking at with a different kind of a perspective. For example, astrologers. See, we have larger astrology services associated with as far as today's situation goes. You pay 5 rupees or you pay 500 rupees, you expect the exact answer, what you are looking for, and if it does not works, then you are somehow devastated in terms of as far as using those services go. So that is precisely what we are talking of in terms of services go. And you see, here comes again the same reference, Kashani K and all the authors associated with this book. Products are tangible and you can touch them, test them, try them, feel them before you decide to buy. And as I said, authors have been comparing products and services wherein tangibility and intangibility perspective is there. So difference has big impacts on the way a marketer can attract a customer. What should you say to persuade a customer, as the authors say, that this service is right for him or her? How should you say it and through which channels? How to emphasize upon the right kind of a service? Service has to be tested. Product can also be tried, but there would be a different kind of a reference point associated with the product. And services, there is always a second thought associated with that. Hotels and those kind of things, we are slightly on the positive side. When we get a reference, we expect a range of, as far as goes that the service quality goes, but when it is a sensitive kind of a thing, as I said, when you have to get a service for an elder at home, then it is a very sensitive kind of an issue. The service marketer has to convince customer of two things: first, the desirability of the service itself, and the ability of the company to deliver on what is promised. And if we are talking of individuals providing services, then it is again a very typical kind of a thing which one has to understand. And today, for example, there are so many yoga teachers, they teach yoga. How intensely they would take you there. You see, I somehow feel, I personally feel that I do not know anything about yoga. So, for example, if tutor teaches me, I can't object to that, you are teaching me right or no on the basis of whatever I have seen on internet. So how, how would I be generating an ability to question the delivery which has been promised? For example, somehow I am working on being more agile and flexible and so on, and I do not do that because somehow I am also involved in that whole situation. So how would I question as far as the situation goes? And that is why authors talk about the involvement of customer somehow in due course of time. Production and consumption of services are often simultaneous. Hence, it can be difficult for the supplier to either check the quality before the customer consumes, or to know when the customer is going to demand a service so as to have the appropriate capacity. Now, this is where the key to innovation and making service marketing effective is to make the intangible tangible, as the authors say. But remember these few words which I talked about in commitment, intensity, reflexivity, discipline, I am there for you, ownership, these 4 or 5 things alongside expressing the service tangibly in the communication of the brand, extending the tangible expression of the brand to all contact points between the service provider and the customer, providing a service guaranteed to express the intangible in a tangible way, packaging the service, making it look like a product, the best of both worlds, under promising and over delivering. Now, this is interesting basically, but again here all the point is that the customer should feel satisfied and delighted. In many cases, for example, customer seeks a lawyer, someone seeks a lawyer, that means there is a dispute. So, customer is looking for a resolution in terms of dispute goes, and that should go in the favor of the customer. However, the customer is on the wrong side, but then the lawyer must justify the nuances, right, lawyer must win for the customer, and that is what they are looking at. Many times it is not very right that every case should be won, which I personally feel in terms of whole of the, I am no one to comment and I am no expert on that, but I have seen lawyers striving to take the customers towards the grey area, if not the white area completely many a times. Corporate cases, if you will study, and I discuss ethics in my classes sometimes, and legal aspects, they are somewhere between black and white. So those kind of things are always there, but lawyers try to do the bit, and that is how they are surrounding the situation in terms of these 5 points, as well as commitment and those kind of things which we have talked about. Communicating the brand, though there are changes in the degree of intangibility of the service and in the intensity of customer involvement, businesses need to supply some form of reassurance before the customer will buy. ICICI Bank in 2021 launched the voice banking service, enabling customers to undertake a host of banking requirements with just a simple voice command. This novel facility offers customers way to connect with their bank from home during COVID, when they were advised to stay indoors due to nationwide lockdown. An interesting situation, extending the intangible extensions of the brand. There are so many points of contact between the service provider and the customer that has to be conveyed briefly and succinctly in advertising, can be reinforced vividly and in more detail to underline the tangibility of the intangible. How well we would be able to serve. Many times you would have seen these advertisements saying that we are there for you always, just on a call basis. I remember one coaching service preparing students for IIT JEE. This service talks about tutors available 24/7, and they did that. A boy I know who was preparing for that exam, he used to contact the tutor on the other side any odd hours, and he could find those tutors, and those were also these tutors are also young boys and girls from different kinds of best of the engineering institutions of the country. They have initiated this project, and I realized that yes, they are keeping up to that kind of a level, and they are pushing that thing towards tangibility in terms of from intangibility to tangibility, and satisfying the queries of the students at any part of the time they would ask for. This is the kind of intensity people have started bringing in. I have seen a portal, a website associated with a call center, wherein people many times they ask for help in terms of as far as their mood goes, and someone always comes, and that someone is as fresh as ever, even if it is 2 AM in the morning. How are they keeping up to that level? How are they keeping that charm? How are they training their workforce? That is an important kind of a thing which is required as far as the whole service scenario goes, and these are typical kinds of services which are evolving in due course of time as per the needs of the customers. Contacts may be physical, the messages conveyed by the service provider's office, store, reception, truck, stationery, etc., or made through interactions with the service provider, staff, waiters, drivers, call center employee, consultants, and so on. You see, we have different kinds of stories in especially in hotel business, and I was staying in a guest house long back when there was a senior professor who was also in an adjacent room, and we got sad news from his home back home, wherein someone very dear to him passed away. And I remember that whole of the staff of that guest house actually made his stay very comfortable during that sad time before he could leave, and his travel was arranged, and they zealously, enthusiastically arranged for his travel without taking note of what he wants in terms of as far as the price of travel goes. They arranged everything as if it is their thing basically which they have to do, because they wanted that somehow he should reach there early, and they never asked for what you could pay or not, and so many people, senior people from that guest house staff, they came in and they talked to him, and they so those kind of things were done. You see, we may say that these are humanitarian elements, but that is what we have been talking about: commitment, reflexivity, and discipline. Guaranteeing the service. A service guarantee can be a very good way of persuading customers to buy from you. FedEx says that if a parcel is not delivered when it is supposed to be, you do not pay for it. You also get your money back if the company cannot track the parcel within an hour. That is one part, but we have seen several stories about Federal Express. Castaway is one of the most favorite movies I have seen in due course of time, and I remember I have mentioned about that earlier as well. So, you see, there are several stories about the commitment of their team members, the staff members, and those stories have become legends in due course of time when we are addressing about the scenarios which these companies they have built in due course of time. Packaging the service. Another way to make the intangible tangible is to package the service so that it looks and feels more tangible. Packaging a service rather than selling each item separately makes it easier for the customer to assess what is in it. Personal health insurance used such a technique, offering completa for all inclusive care using all medical techniques everywhere, as opposed to Protecta, which provided minimum insurance cover. There are many insurance companies which have started prompting their customers to keep their health good. There are many apps which prompt the customers through mobile phones that today you have not walked so much and so many steps are still remaining, and insurance companies they are trying to back up. There are several premium schemes. If you maintain your health well, you pay less as far as the premium goes, and that is how you are actually making inroads in terms of real time connectivity with the customer and saying that I am there for you somehow. Then there are several insurance services which actually provide the support in terms of their call center provides you support in terms of where you should go in terms of requirements as far as the services go. Best of the both worlds. With services it is better to say less and do more, better to reduce the promotional budget and use the savings to improve quality of service. I am there for you. Paris Metro spent a fortune on an advertising campaign called Ticket Chick, Ticket Chalk, Chick Ticket, Shock Ticket. The intention was to make customers believe that it was chick upbeat to ride the underground and that the price was shockingly reasonable. However, what customers cared about were crowds, perspiration, noise, the feeling of insecurity, beggars, dark tunnels. Soon a new advertising campaign was launched to emphasize the progress that had been made towards increased safety, comfort and cleanliness. Indian Railways has been focusing upon these kind of things. IRCTC has come a long way in terms of providing the services go, starting from ticket booking to airlines booking to food booking to meal confirmations and to getting the meal at the desired station and whenever you require, and then systems associated with calling for help and security and those kind of things go. We have come a long way in terms of as far as linen go and bed covers go and blankets go. Everything has been made so professional, and especially the trains wherein your chair cars are plying from fast running trains, the food quality has increased a lot, and it's an experience when you travel by these fast running trains like Shatabdis and these kind of express trains, and we are going ahead in that direction, going for further super fast trains and so on. Best of the best as far as the situation goes. Vande Bharat Express, which is the new launch, is doing extremely well and people are delighted about as far as the performance of the not only the train goes but the in train services, and that is where we are talking about as far as the whole situation goes. Aravind Eye Care came into existence at around 1967. It is a legendary organization. Remember, when around 1.5% of then 637 million population in India was blind. In 1967, the number was huge. It was not just blindness, as the number of people who could not see good enough was even higher. A part of these blindness was not necessary and was preventable and treatable. I was talking to a doctor from All India Institute of Medical Sciences, Rishikesh, and she told me that there are many patients who come to them with lime injury, chuna injury, this common lime powder, and then their eyes, they get the dust and their eyes get destroyed in due course of time. So, these are preventable diseases. Most of this occurred amongst the poor and who did not have enough economic resources for treatment, or to people in rural areas who face challenges in accessing those services. These challenging marketplace became the source of first innovation for Aravind Eye Care. It is a wonderful story, and they started their organization with the mission of eliminating needless blindness. Excellent thought. Aravind Eye Care has come a far long way, and there are several hospitals and organizations abroad who follow this model. They provide large volume, high quality and affordable care. 50% of the patients receive services either free of cost or at steeply subsidized rates, yet the organization remains financially self-sustainable. A critical component of Aravind Eye Care's model, is the high patient volume, which brings with it the benefits of economies of scale. Arvind's unique assembly line approach increases productivity tenfold, and this again we have taken from fortune at the bottom of the pyramid. But this model is still working at one of the best levels and paces, despite of the fact that it was mentioned by Professor Prahalad in 2006, and since then and before then there are several kinds of texts and papers which have been written on this organization. Over 4.5 lakh eye surgeries or procedures are performed a year at Aravind, making it the largest eye care provider in the world, and that is when the text mentions it in 2006. So, 5 lakh eye surgeries, today they have reached a larger kind of a, so huge statistics. If you will go for decadal kind of a statistics associated with this organization, you would realize that they have served millions of people. Now, this is the model which Aravind Eye Care is all about: patient centered care, wherein financial sustainability, quality, efficient service, giving value, high volume, reaching the people, all are associated with commitment, discipline, reflexivity. And Dr. Govindappa Venkataswamy, or popularly known as Dr. V, founded Aravind Eye Care in a rented house in South Indian city of Madurai. And Dr. V was very impressed by the golden arches of McDonald's during his visit to America. He wanted to know if the assembly line efficiency that made hamburgers available in the street corners of every town in America at a price everyone could afford be harnessed to the mission of the fighting blindness as well. lot of innovation in terms of looking at that model with the perspective of serving people for eye care. And that is what Aravind Eye Care did, alongside when this organization conducts regular health camps, have their own eye banks and training services, and the Oro Lab, a manufacturing facility by Aravind Eye Care, makes quality ophthalmic products that are affordable and accessible. They are traversing into different value chains, connecting those value chains with themselves. If you will look at this case study through this reference and through their website, you would realize that they justify not only the preceding discussion we have had in terms of changing scenario as far as marketing and services, marketing of products and services go, they also justify the innovation in services marketing, innovation in marketing of services. I will leave you with this thought. There are several such kinds of examples in India we are proud of. I will leave you with this thought, and I will be joining you back with other exciting segment of this course in due course of time in my next session. Till then, goodbye.